Fluoride is known to elicit numerous ill effects in organism. The primary excretion pathway for fluoride is the kidney, making them susceptible to its impact. In minor quantities, they are essential for dental and bone enamel mineralization, forming fluorapatite. However, chronic exposure becomes toxic, leading to fluorosis. Studies have indicated that fluoride can elevate blood glucose levels and disrupt glucose tolerance, possibly by impeding insulin production or secretion. Let's delve into the intricate relationship between fluorosis and the blood glucose regulation with our esteemed guest, Professor Dr. Shashidhar Nagaraj. He's a professor and head of Department of Biochemistry at Sri Devraj URS Academy of Higher Education and Research, Karnataka. With a profound research interest, Dr. Nagaraj has authored over 70 journal articles. We are truly honored to have you with us today, Dr. Shashidhar.
Thank you, ma'am.
So let's start the session. So, Doctor, you can proceed to share your presentation.
I thank the Synapse community for giving me an opportunity to say a few things about the dimensions in fluorosis. Myself, Dr. Shashidhar KN, professor and head of the Department of Biochemistry, being the lead director of Fluorosis Research and Referral Laboratory, which has been established in the Kolar, which is to the eastern part of the Karnataka, India. We have started this fluorosis research and referral lab with a concern that the fluoride has a lot of impact on the local population. So the local population were suffering from the skeletal fluorosis. In addition to the skeletal fluorosis, it has been observed in the local population that the non-skeletal fluorosis also has become very rampant with respect to the local population. The younger generation of the age of around 20 to 30 years have started getting diabetes more in this local population. And as a dictum, it has been observed that 1 in 3 patients who visited the hospital had diabetes. Here, the complications of the diabetes, particularly the micropathies, there is the diabetic nephropathy, has become very rampant in this local population, being the groundwater level, which has crossed more than 1,300 feet due to the decreased rainfall and various other things. The minimum water fluoride level is supposed to be 0.2 ppm, for which initially the toothpaste and other things were added with the fluoride. Now the fluoride level in the local water has crossed more than 4.1 ppm, despite taking a lot of issues pertaining to the fluoride filtration and various other things. The point of concern for today's discussion is chronic exposure to the fluoride. Will it affect the intricate mechanisms involved in the blood sugar regulation at the molecular and cellular levels, and the various populations and the individuals with pre-existing diabetes? Are those with compromised kidney function? Were they susceptible to the detrimental effects of the fluorosis on the blood glucose regulation and other things? The potential long-term consequences of the fluoride with respect to the impact on the blood glucose regulation, fluoride exposure and fluorosis on the intricate balance of the sugar regulation in individuals with pre-existing metabolic conditions. As we all know that the diabetes is a metabolic disease affecting the various multi-organs are involved with respect to this, and any notable interactions or the synergistic effects between the chronic fluoride exposure, hormonal regulation, enzymatic activities, and various other genetic exposures and various other things. There are various recent advances that has been made in elucidating the underlying molecular mechanisms by which the fluoride-induced changes in cellular signaling pathways has affect the blood glucose regulation. And there are various recommendations that has been made with respect to the interventions and treatment strategies. There are various gaps and limitations despite the lot of research that has been carried out with respect to the fluorosis, and the preventive and various other management approaches needs to be concerned. So with this, let me give a brief introduction about the fluoride, the molecule of interest for today's discussion. It is the 13th most abundant element in the Earth's crust. It exists as a fluorine in nature. It is one of the few elements that have been shown to cause significant effects. The various sources that are related with the fluoride includes the drinking water, the air, the dental products, foods and beverages. In the periodic table, if you see, It occupies the 17th column of the periodic table, and there are various types of fluorosis that has been documented: the skeletal, non-skeletal, dental fluorosis, of which it is the non-skeletal fluorosis which we are concerned of, because the skeletal and the dental fluorosis has been studied worldwide, and a lot of studies has been done and a lot of research has been done. The non-skeletal fluorosis includes the disorders that are related to the intelligent quotient in case of children, thyroid disorders, early diabetic cataract, and hearing deficits with respect to the children, autism, thyroid disorders, cardiovascular disorders, gastrointestinal disorders, and reproductive system is also involved with this, and various other things. Musculoskeletal disorders are also involved with respect to the non-skeletal fluorosis. So these things made us important in to study the various impacts of the fluorosis on the non-skeletal, particularly the non-bone related. Because the bone related things has already been known that it will lead to the bolex and various other things. The mechanisms of the dental fluorosis also has been studied in depth, where the action of fluoride on the proteinase enzymes, which are responsible for the enamel's organic matrix synthesis, inhibits the resulting in precipitation of the amylogenin, which is required for the formation of the plaque and various other things. So these things made us to take a study on the non-skeletal fluorosis, as the fluoride is known to damage the DNA of the cells in organs which are involved in the metabolism, which results in the mutations in the signaling pathways of the enzymes and proteins, leading to the metabolic damage and depreciation in normal cell functioning. So these mutations, where exactly the mutation lies, and is there any impact of the fluoride on the various other metal ions, for example the magnesium, manganese and various other things, the phosphate ions, are it also involved with the DNA damage and other things, needs to be studied, which we are concentrating more on this. The non-skeletal fluorosis, as I have already mentioned, it has got an impact on the CNS, be it Alzheimer's disease, be it intelligent quotient, be it various other Parkinson's and various other things, stroke, depression, psychosis and various other things, cardiovascular diseases such as the coronary heart disease, ischemic heart disease, renal ischemia, calculus and various other things, gastrointestinal, starting from acid peptic disease to the cancers, hematological conditions including the various anemias, hemoglobinopathies and various other things, reproductive system starting from infertility to the cervical cancer we have touched upon. This is my team, which includes Dr. Munilakshmi, myself, Dr. Sai Deepika and Indumati. In addition to that, we have Sharan with us, Dr. Sharan with us. So these are the instrumentations that we are using with respect to the fluoride estimation. This is the ion selective electrode, which has been procured from the Thermoscientific Orion Star. And this is done with the help of the TISAB buffer. Total ionic strength acid buffer is the one that we use. And we have a pH meter and centrifuge. So this is in brief presentation about the fluorosis research that we are taking upon in our center. Now over to ma'am for any queries and questions. You can please go ahead with the questions.
So, I wanted to ask, like, based on the latest research findings, how substantial is the impact of chronic fluoride exposure and fluorosis on the intricate balance of blood sugar regulation in individuals without pre-existing metabolic condition?
Ma'am, it has been documented that the fluoride has got an impact on an enzyme called as the enolase, and there is a effect in the enzyme activity that whenever the enolase enzyme is inhibited with respect to the glycolysis is a mechanism where the glucose will be broken down into pyruvate or lactate depending on the aerobic and anaerobic condition. So based on this, the enolase enzyme, when it is inhibited, there is a competition between the fluoride and the magnesium ion to bind at the active site of the enolase enzyme. Instead of the magnesium ion and the manganese, this fluoride ion will go and bind with the enolase enzyme. So once this enolase enzyme has been blocked, then what will happen? The substrates that are there with respect to the glycolysis, the 3-phosphoglycerate, then dihydroxyacetone phosphate, glyceraldehyde 3-phosphate, and all these molecules starts accumulating and finally the glucose. Now the glucose, instead of entering into the straight glycolytic pathway where it is blocked by the fluorosis, the glucose molecule will enter into an alternative pathway called as the polyol pathway. In the polyol, it will help in the synthesis of certain molecules such as the galactitol, sorbitol, aldactol. All these molecules are synthesized. These molecules, once it gets accumulated in the cytosolic compartment of the cell, it is highly hygroscopic in nature. So this molecule, these polyol molecules, once it absorbs the water component that is there in the cytosolic compartment of the cell, it swells. Once it swells, then what will happen? Be it the neuropathy, nephropathy, retinopathy, these things to happen where there will be transmission of light may not be proper, and it will lead to opacity of the lens material, retina. So conduction of the nerve impulse in the retina will get affected, peripheral nerve impulse will be affected, the glomerular basement membrane of the kidney will be affected, so the filtration of the kidneys will be affected, so that various other damages to happen with respect to these components of the body, so that ultimately it will lead to the damage. The long-standing effects, that is the microvascular complications, will be resulted with respect to the chronic exposure to the fluoride.
So, moving ahead, considering the available evidence, do you recommend any specific interventions or treatment strategies for individuals affected by both fluorosis and blood sugar dysregulation, such as lifestyle modification or targeted therapies?
Yeah, there are two things here. One is diabetes is a multifaceted disease. So it has got hormonal regulation, it has got dietary regulation, lifestyle modifications, and so many other factors are involved with respect to the diabetes. So once the diabetes are under control, the intricate mechanism that is happening in the cell can be controlled with little exposure or avoiding the exposure to the high fluoride, or by taking an action against which the fluoride entry into the cells and other things can be avoided. So let me speak few things about the diabetes. So initially, then let me come to the fluoride. So the diabetes, as we all know, there are four types of diabetes: type 1, type 2, gestational diabetes mellitus, and other types of diabetes mellitus. The type 1 diabetes, it is due to the deficiency of the insulin. Obviously, there will be deficiency of the insulin that do not happen with respect to the beta cells of the Langerhans. So there is a recession between the demand as well as to the supply of the insulin. With respect to the type 2 diabetes, so there will be a receptor defect where the insulin receptors will be defective, so that regulation of blood glucose do not happen. Type 3 gestational diabetes, it is a transient, occurs during the pregnancy and goes off once the pregnancy, but it is a pre-diabetic condition. So these people should be very careful once the pregnancy is taken care of. The other types are due to the counter-regulatory hormones that are there in our body, be it the thyroid hormones, be it the corticotropic hormones, be it the adrenaline, noradrenaline, that is epinephrine and norepinephrine, or the various other steroid hormones that are there in our body. Now, for control of the diabetes mellitus, the dictum, the thumb rule is eat less and walk more. The sedentary lifestyle and other things needs to be taken care with respect to the control of diabetes, irrespective of type 1 or type 2. The lifestyle modifications such as the smoking, alcohol, and various other things, the obesity needs to be taken care. So all these things, waist-hip ratio needs to be maintained to be less than 1, so that the postponement of the diabetes can be taken care. Because if it is genetics that are involved with respect to the parenthood and other things, so there is a lot of chances that the siblings are going to get the diabetes mellitus. The offsprings are going to get the diabetes mellitus. So for these things, we can't avoid, because the genetic mutations might have already been happened in the diabetes, in the insulin gene or various other counter-regulatory hormones that are related with the diabetes mellitus. So this is with respect to the diabetes, the bird's view with respect to the diabetes. So lifestyle modifications, dietary control, regular exercise, reducing the stress, these are some of the things that needs to be controlled. And once this diabetes is controlled, the microvascular complications of the pathies that are involved with the diabetes, so that is the retinopathy, neuropathy, nephropathy, cardiopathy, all these dermopathy, all these pathies can be postponed to certain extent. It has been observed that any person who is having a diabetes of more than 5 to 10 years are known to get these pathies in future. So this is with respect to the diabetes. Let me come back to the fluorosis. As I have told you, this fluorosis, fluoride, is the one that is going to inhibit the enolase enzyme, which is the main enzyme which is involved with the causation of the diabetes mellitus. So to avoid entry of the excess fluoride, there are various other dietary sources. Of late, we have started consumption of tomatoes, which are rich in this fluoride, and cabbage, which are rich in fluoride. So these diets needs to be avoided. And RO water has to be consumed more, either for cooking or for various other things. We need to use this type of RO water, because three types of water we will be using regularly. One is for washing of the clothes and other things, where the fluoride that has been there will get in contact with the clothes to the skin and it gets absorbed, and direct consumption of the fluoride, or for the various other things, the cooking purpose and other things, where we will be using the non-fluoridated water. The main disadvantage with respect to the RO system that we are using as on date, the molecules which has got the same composition that of the fluoride will also gets filtered out. So these ions are also involved with the various other enzyme activities, and those ions are also having an impact on the diabetes mellitus or the insulin synthesizing gene. So we should be very careful with respect to when we are selecting or using the RO filters that we are going to use. Then, how to prevent these things? Consumption of more of the tamarind instead of the tomatoes with respect to the diet. Consumption of drumstick leaves. So these are some of the things. Jaggery instead in place of sugar. So these are some of the things which we can think of, so that which will avoid entry of the fluoride, or even if the concentration of the fluoride and other things are less in this. Then it has been, studies have been documented that the consumption of tea increases the fluoride absorption in our body, because the tea leaves has got the highest concentration of the fluoride with respect to the other leaves that we consume regularly. If you are a regular tea consumption person, and if you are already been exposed to the high fluoride concentration, so we should try to avoid consumption of tea to certain extent, to as far as possible. And it has been observed that green tea is one of the better option as a substitute for this. And again, it is a controversial statement, because still we are not clear whether this green tea is protective against the fluoride exposure or not. So these are some of the diets that we need to concentrate upon.
And Professor, what gaps or limitations still exist in our understanding of how fluorosis impacts blood sugar regulation? Which areas of research do you believe should be prioritized to address these gaps?
Ma'am, one is at the population level, at the community level, the knowledge, attitude, behavior, as well as the education with respect to the fluoride needs to be addressed upon. School health education needs to be taken care, and the community health and the population education needs to be taken care with respect to the fluoride. Next, at the scientific level, the scientists needs to concentrate more on the fluoride at the cellular level, be it the cell culture, or once it has entered into the body, to what extent this fluoride is going to mutate the DNA, where it will be transmitted to the RNA to the protein, so that the insulin or the counter-regulatory insulins are going to get affected. So these are the things the scientific community needs to concentrate now in the population who are exposed to the high fluoride concentration, on the chronicity of the fluoride exposure. Because as on date, the water table, wherever we see the water table, has crossed more than 700 to 800 feet. So that is the water that we are consuming, and it has been, studies has been documented that the deeper the level of the water that we consume, the higher the fluoride concentration, because the fluoride that is there in the stones, earth crust, all these things will get mixed. It will get endosmosed into the water that we are going to consume, and it is the water that we will be consuming. So these are some of the concerns with respect to the scientific, with respect to the population, that we need to address upon.
Yes, Professor. And now, considering the potential impact of chronic fluoride exposure on blood sugar regulation, how important it is for healthcare professionals to include fluorosis assessment and management as part of routine diabetes care?
Yeah. So, in addition to the routine examination that is done with respect to the diabetes, there is the whether it is the fasting blood glucose, postprandial blood glucose, random blood glucose, HbA1c, or of late the fructosamine is also one of the one that is the glycated albumin is also an important molecule that has been included by various centers who are treating the diabetes mellitus, the lipid profile, and various other things that are involved with the diabetic evaluation. In addition to this, the regular fluoride estimation with respect to the population who are exposed, that to chronic exposed to the fluoride, also needs to be assessed so that the impact of the fluoride on the insulin, in addition to the insulin estimation, the C-peptide estimation. So, in addition to this, the fluoride also needs to be estimated to say that yes, person X is getting exposed more to the fluoride, your levels are getting more, so that there is a chance that the impact of this fluoride on the various other cellular enzymes are going to get affected. So it is better you start consuming tamarind instead of these tomatoes and other things. The health education needs to be done at the treating physician or at the family physician level itself.
So, Professor, my last question is, are there any promising preventive measures or management approaches?
Yes. Number one, usage of RO water. Number two, to replace tomatoes with the tamarind, consumption of drumstick leaves and other things, consumption of green leafy vegetable, sprouted grains, avoiding exposure to the high fluoride, filtration of the water. There are various methods that are available for filtration of the water, be it the drinking water, be it the consumption water, or even the cows and the buffaloes that are fed with the water. That also needs to be concerned, and the RO water system should be taken care, because the ones that enters into the buffaloes or cows, that will get excreted through the milk. So that also needs to be taken care.
Yeah, now thank you, Professor Shashidhar. We have arrived towards the end of this session, and it was indeed very informative and interesting session. So thank you for your time and invaluable insights.
Thank you, ma'am. Thank you. Thank you very much.
And a huge thank you to our audience for tuning in. And before we conclude, I want to bring your attention to the MedSynapse platform,